Asymptomatic Ontarians can now buy a rapid COVID-19 test at all Shoppers Drug Mart and Loblaw pharmacies across the province. The cost for a test is $40, and while it may provide peace of mind for some, advocates say the price is a barrier for those who need it most.
Why are we seeing more evidence of profiting off of this pandemic? These tests were created for people to use them. We have a healthcare system that's supposed to be universal. We're in the middle of a pandemic. Why are these being sold?
The service is available to anyone who doesn't have COVID-19 symptoms and hasn't been in contact with a COVID patient. Those who take the test at Shoppers or Loblaw pharmacies in Ontario and Alberta will receive the results in 15 to 20 minutes. Palliative care physician and health justice activist Dr. Maleeha Sheikh says people having to pay for rapid testing is concerning.
We already know that COVID-19 has not been an equal opportunity virus. It has hit communities who experience poverty especially hard. And the fact that there is a price tag of upwards of $40 on this test means that many people won't be able to afford it.
We reached out to Loblaw regarding the cost, and here's what they said. The price takes into account the cost of the test to the business, which were purchased directly from the manufacturer, additional materials required to support the program, as well as the pharmacist's time to perform the screen. This is a program designed to complement current public health PCR testing.
We're in the middle of a global pandemic. We're in a national crisis. We really need government access to these types of tests quite readily. I'm not sure we should be charging people.
According to federal data, the federal government has purchased over 40 million units of rapid tests, which have been spread out across the country. Ontario has received over 11 million tests, but only over 2 million have been used.
If they aren't being used, where are they?
There's also concern about their accuracy. The Shoppers website states a rapid COVID-19 antigen screen may identify the presence of antigens in your body. While this may indicate that you have an active COVID-19 infection, a follow-up COVID-19 PCR test is needed at a public health facility to confirm a COVID-19 diagnosis.
How would they be used? I am not very clear on that, because remember that if you get a positive, you have to repeat the test, right? And that's fine. But what if you get a negative? Could it be a false negative?
While there are still some concerns, Dr. Dasani says they could be a useful tool and should be free in the fight against COVID.
We know the way out of this pandemic is multi-pronged. We've talked a lot about vaccines. We've also talked about paid sick days, but rapid antigen tests have the potential to be able to pick up COVID-19 cases in people who aren't displaying symptoms. They could be a real line of defense.
We reached out to the province this morning asking why they aren't looking into providing free rapid testing for the general public, and they said they couldn't meet our deadline. For anyone who is interested in booking a rapid testing appointment, they could do so by either calling or booking an appointment online at their nearest pharmacy.